all know what acne is, and we all know that almost everybody at some point in their life will get acne. But acne, in its most basic form, is a disease of this hair follicle with the surrounding oil glands. And the oil glands are stimulated by hormones, the hormones primarily being testosterone. And that's why we get so much acne in the teenage years when our bodies are changing and testosterone peaks. Now this video is going to talk about a number of different over-the-counter products that you can use to help keep your face clear, no matter if you currently have acne or if you're just trying to prevent acne in the future. We're also going to be talking about tips on diet, tips on exercise, tips on how to wash your face, and hopefully just kind of wrap your mind around the whole concept of acne in a holistic fashion that gives you the control to help keep a clear, acne-free face. Now we're very fortunate to have a lot of really good products that you can use to help clear your acne. Now we're going to go through some specific examples, but the general rule of thumb is that we do not want stuff that smells like a garden bed. We don't need fragrance, okay? We also do not need harsh things or things with exfoliants or beads that you're scrubbing out your skin. You can't scrub out acne. In fact, the more harsh you are with your skin, the more acne will develop because you're creating inflammation. And that inflammation can help form acne pimples. Now, if we pay attention to what type of cleanser we're using and how we're using that cleanser for different areas of the face that have different demands, then that will allow us to use different over-the-counter creams that stay on, and we can decrease the side effects from those creams because we're not unnecessarily drying out or unnecessarily moisturizing an area that doesn't need to be dry or that doesn't need to be moisturized. It kind of makes sense. Remember, the more gentle you are, the better your acne will do. Acne is not caused by dirt. Now, on the other hand, if you haven't washed your face in 5 years, that's probably a problem. But please do not try to scrub your acne away. Please be very gentle. Makeup. Makeup's a big topic. The more makeup you use, the more it's going to occlude your skin and cause acne. So please be modest with the makeup that you do use. Also, please get a good mineral-based makeup because those tend to cause less acne than the others. So things like Bare Minerals is a great makeup and you can try that. But please put it on modestly when needed, and when you take it off, please be gentle, no excessive scrubbing. All right, a lot of the acne medications that we suggest are going to make you more sensitive to the sun. And so it's important that if you're going to be out and about in the sun, that you protect yourself. Now, my favorite ingredients for sunscreen are zinc oxide and titanium dioxide. And there's a lot of great formulations out there. And we're going to make some suggestions down below for ones that you can use. But please make sure that whatever sunscreen you use it appropriately, and we have videos on that, and that you get one that does not cause acne. We don't want to be putting any products on our faces that will cause acne if we're trying to prevent acne. Kind of makes sense. And the fancy $10 word for that is non-comedogenic or non-acne causing. Please make sure the sunscreen that you use has that in it. One big caution is pregnancy. We'd like you to not use anything that you don't have to use if you're pregnant or you think you might be pregnant. So if you're pregnant, or if you think you might be pregnant, or if you're breastfeeding, please don't use any of these until you consult with your local doctor to make sure that it's okay for you. Now we're about to talk about diet. And we all know that diet is vastly important for our health. We need to be following a diet that will produce health not just for our skin, but also for our brains and our lungs and our hearts and our kidneys. We have to put into our body the solid nutrients and ingredients needed for health.
Hi, I'm Charlene Wong, Integrative Registered Dietitian and Certified Level 5 Healing Touch Practitioner. I'm going to talk about how to address acne with nutrition. If you feel like you've tried just about everything to clear up your acne and nothing seems to be working, why not go back to the basics, your diet? Affecting up to 50 million Americans each year, acne is the most common skin condition in the United States. What are the top 3 foods linked to acne that you'll want to avoid? Number 1, high glycemic simple carbohydrates. Number 2, dairy. And number 3, fried foods, none of which are helping your complexion. In fact, studies have found that these foods stimulate the production of hormones that can cause you to create and excrete excess oil from your oil glands. Ideally, you want to eat in a manner that keeps your blood sugar nice and steady. And some of these foods can cause your blood sugar to spike. When your blood sugar spikes, it causes your body to release an excess of hormones called insulin. Having excess insulin in your bloodstream causes your oil glands to secrete excess oils. The second food group you want to avoid is dairy. Milk contains a component related to the hormone testosterone that may stimulate the glands in your skin, setting the stage for acne. The third type of food you'll want to get rid of is fried food. We all know that fried chicken and French fries aren't doing our health a favor, but if you're prone to acne, you may want to reconsider taking another bite of fried food. So then what are the foods that you want to implement in your diet to decrease acne? The top 3 are omega-3 fatty acids, also known as the good fat, an adequate intake of water, and low glycemic complex carbohydrates. Your skin is a reflection of your health. Eating a nutritious diet will keep you healthy internally and will reflect externally. My best advice in dealing with acne with nutrition is to eat a balanced, wholesome meal, abundant in fresh fruits, fresh vegetables, plenty of water, omega-3 healthy fats, and lean protein.
We all know that exercise is vitally important to keep not only our heart and lungs alive and functioning, but also our brains and our skin and everything else about us. So please get your 30 minutes of exercise in a day.
Hi, I'm Angela Anderson, Certified Group Fitness Instructor, and here to talk to you a little about skin and exercise. Exercise is not only good for your mind, body, and spirit, but also for your skin. Studies show that sustained cardiovascular exercise can actually promote growth of collagen in your skin. That's right, you can make yourself look younger and healthier just by getting the recommended 30 minutes a day of moderate intensity exercise. Remember to consult your primary care physician before engaging in an exercise regimen. Also, a quick tip is to make sure you shower after you exercise. This will prevent the sweat from drying and sticking to your skin, which actually can help cause acne. So if you don't have access to a shower or can't right away, just go to the bathroom, wash your hands fully with soap and water, and rinse your face off so that you're not promoting acne growth on your face. If you're exercising outside, don't forget your sun protective clothing and your non-acne causing sunscreens. I hope you found these tips helpful. Thank you.
Now please understand that with all of these things, more is not better. I want you to use what I suggest, the amount that I suggest, because that should work. And it shouldn't unnecessarily increase your side effects. Please remember that acne takes about 4 to 6 weeks of a continuous, comprehensive treatment plan before we know if it's going to work or not. A lot of people think, okay, I put it on last night, today I should be great. That's not how acne works. You need to give yourself 6 weeks. And if you try to rush it by using 5 times the amount that we suggest, all you're going to do is get increased side effects and your acne will not get better any quicker. Now obviously with everything that you try, if you start experiencing side effects that are extreme, that are going beyond just a little bit of irritated or dry skin, please stop everything. Call us and we'll get you in sooner. We do not want you to wait if you're having a side effect. We want to know what's going on. So please communicate with us if anything that we're recommending is causing more than just a little localized irritation or rough spot. So we're going to give you about 6 weeks until your acne appointment to see if you can help control it by changing around your cleansers, your moisturizers, over-the-counter products that you can use, by monitoring your diet, by doing appropriate things after you exercise. If you get the level of control that you need, perfect. Keep it up, cancel your appointment, and we'll give it to somebody else. If you don't get the level of control you need, please come in with a piece of paper for everything that you've been putting on your face and how it has performed or not performed to your satisfaction. It's really important that you come in with no makeup on. It's really hard for us to see through the makeup. And one thing that I would ask of everybody is take a picture when you start treatment, and take a picture at 2 weeks, 4 weeks, and 6 weeks. If it works for you, feel free to post it online. Tell others what you have discovered and what's worked for you. And if it does not work for you, bring those pictures in so that we can quickly scroll through 0, 2, 4, and 6 weeks and see for ourselves how things are or are not progressing.